Good evening, everyone. So this is Dr. Deepa from Mahindra Insurance Brokers, and we welcome you all for the today's sessions on Monkeypox, which is organized by Mahindra in collaboration with BLK Max Super Speciality Hospital. On behalf of all of us, I welcome and thank Dr. Anil for taking out some time from his schedule and to shed some light on the topic. Dr. Anil is a Senior Director in Hospital Lab Services and Chief of Academic Affairs, Research and Continuing Education in BLK Max Hospital. He has done his MD in Pathology and Fellowship in Hematological Medicine and Flow Cytometry from London and Australia. And he has an experience of more than 10 years. So he's come up with some great experience and the knowledge about this topic. So we welcome Dr. Anil on board and we look forward for the sessions. Over to you, sir.
So, good evening, ladies and gentlemen. And at the outset, I would like to thank the organizers for giving us this opportunity to talk about the new thing which has come up in the recent past, and that's about monkeypox. So, the next slide, please. All right. So, when we talk about monkeypox, it's actually a disease which is caused by a virus. We have been engulfed with viruses for the last now almost 2.5 years. In fact, viruses have been there around us for since the time we have known as any living thing on this earth. So, no new thing. It's the same pox virus family, which has exactly been there. The earliest pox virus which we've been struggling with has been the virus which was, what is called the smallpox virus. And I'm sure all of you would have known that smallpox virus is something which has now become extinct in India. We don't have any other known diseased patients of pox in the country so far. So, which is a good thing. But at the same time, this is a new thing which has started coming up. And this particular virus has been first reported in Central Africa in the year 1970 and primarily has been affecting monkeys. And that's how the term monkeypox has come into the picture. And when people contract this disease from the animals, that is the source is usually animals, they generally have a typical, pox-like disease like smallpox or chickenpox, wherein you have fever, you have rash, and you have, swellings in all across the body, which is otherwise the lymph node swellings. Now, what is very, very important to realize is that we do not want to have the disease primarily, not because we will get these small little rashes across the body or some complications respect to that, but at times it can become, really detrimental for people. People can die. So that's where, complications of monkeypox is something that we are most concerned about. Next slide, please. Now, as the name suggests, it is first emanated through the monkeys, in Central Africa, which I just mentioned. And just look at the face of the monkey here. You can see that you have these small little reddish kind of pustules or elevations on the skin of the face of this monkey, which you can see on the left. And the reason why it has because it was a disease which was actually limited to monkeys. It was, or the animals. It was not really supposed to come into the human beings. But why did it come to the humans is because of the fact that one, we started, kind of being with the monkeys there. And more importantly, we also have certain food habits, of killing monkeys and eating their meat in Africa, which has actually led to this kind of an activity. Eventually this virus has also gotten transmitted from monkeys into humans. Next slide, please. Just look at the kind of picture which you see here. The one which you're seeing on the left hand side, the first one is the picture of a person, of a child, which is actually from Wikipedia. And you can see that this is a smallpox. And when you look at the other pictures which you're seeing on the right hand side, they are of a monkeypox. So practically speaking, they look similar in terms of the fact that it's almost the virus which is affecting these children is from the same family of pox families. Next. Now, when you look at this particular image, what I'm trying to show you here is the worldwide distribution of this disease. So if you look at the worldwide distribution of this disease, what you will notice is the ones which are showing gray color are the ones where no case has been reported so far. Of course, we know that one case from India was reported some time back, But fortunately, that case did not transmit any further infections to anyone. And therefore, for all practical purposes, all the areas which are in gray are the ones which have been shown to be not having the pox disease, the monkeypox disease at this point of time. But all the other areas where you can see, kind of yellowishness. So therefore, the ones which are highlighting, I'm highlighting the country India. And if you see the blue map and the white map, can we go back? This blue and the white map is actually from two different sources. One from the WHO, the blue one, and other one from the global dashboard, which is coming for the monkeypox. And in both of these, you can easily see that India is fortunately so far not really having any disease. But where it is prevalent very prominently, as you can see, is the area which is there in America and of course in Europe. So these are the two areas where it is going up significantly. What we really need to know, next slide please. So what we really need to know is these miscellaneous aspects which a lot of people don't even want to think about. So the first point is, how do we control this infection? Do we, stay home, or do we go to a hospital? What should be the duration of isolation? Do we decontaminate surfaces? And when we look at monkeypox virus, will it really cause a pandemic? For all practical purposes, since we have very little number of cases across the globe and it's limited to certain areas only, it's more likely that we may not have this disease affecting people to a large extent. And therefore, another important aspect which has been observed is these cases have been predominantly seen in populations which are, kind of exposed at a lower strata of the economic, socioeconomic status. Next. Yes. Now, this is very, very important, which we all need to remember. Once somebody has been, kind of exposed to a person having monkeypox, it usually takes between 6 to 21 days. That's about 1 to 3 weeks to get the symptoms. So therefore, that's why when somebody is traveling abroad, especially to areas where there is prevalence of monkeypox, and you are coming back to our country and you are having some symptoms, then the person is expected to be isolating himself for the next 21 days. And remember, when somebody gets, the rash on the body, the person becomes communicable in the sense that the person is able to transmit the infection for the next 1 to 2 days before the rash will subside and scab off. So for all practical purposes, 6 to 21 days is what the incubation period is, and that is the most transmissible period for this virus. Next, please. Now, in addition to the infection which is getting spread from the skin as well as from the respiratory droplets, that's when somebody sneezes and coughs, it also has many other atypical presentations, and that's got to do with a lot with the sexual interactions. Especially it's been reported in some homosexuals, wherein it's been seen pretty more commonly, especially again in the Central Africa. And it has been, in fact, today also when we are talking about it, a lot of it is still not known to us. But what we know is that it is not typically a sexually transmitted disease. However, in sexually transmitted cases have also been seen in this particular disease. Next slide, please. Now, how do we distinguish? Because, in a country like ours, where we have measles, where we have chicken pox, where we have other pox related disorders which are already available, how do we differentiate those diseases from this particular disease? Now, out of all the important aspects, what is the most important is a comprehensive history, and again, when we are talking about history, our main concern is to know where has the patient traveled in the recent past. If the patient has traveled to the area where monkeypox is pretty prevalent, then the chances of that person having this kind of a disease is much higher than the rest of them. So remember, typical history usually is that the patient would have had fever, they would have had body ache, headache, sore throat, cough. All this would be there. And in addition to that, people will also have rash on the skin and across the body, predominantly affecting hands and feet and limbs. And there may also be pain and some itching, which is also seen in some of the patients. So remember, one very important thing is that not all patients will have all these symptoms. Some of them may have just one or two atypical symptoms, and you may not be able to differentiate. So therefore, important point is we need to be suspicious in a patient who has traveled to an endemic area or an area wherever the monkeypox is pretty prevalent. Next slide. Next slide, please. All right. As I told you previously, social history, how the patient is actually interacting with the kind of people he is interacting. And I told you already about travel history where people are, visiting, for example, Central and West African countries. And again, even in the US now, it started becoming kind of prevalent in some of the areas. And of course, also important to know that if a patient has exposed himself to somebody who has already had a contact with monkeypox. So all these are extremely important, from whom we can potentially get it. Next slide. Now, when you look at a patient, this is how a typical patient will look like. The person will usually have these lesions which are there on the skin. You can see in this particular case that the patient has these small little pustules which are there on his body, and of course, predominantly they're on the face and the arms and legs. And when we say that face, arms, and legs, that means it's sparing the body, the center of the body. This is in contrast to the disease like measles, in fact, in India, measles is called Mata Ana. So, Mata, when you get measles, in such cases, the rash is predominantly in the body rather than on the face and the limbs. But in this case, the body is relatively spared, and it is predominantly on face, arms, and the legs that you see it. And the stage will be very different in different cases. I'll show you some of the slides as well. Next slide, please. So this is something which you see on the hands, of this patient. Next slide. Now, as I told you, what are the signs and symptoms? Very classically, it's like a flu-like symptom, just as the way we used to have in COVID, almost similar features as far as the disease is concerned when it starts with. And then I told you, then you will have rash, and this rash will obviously affect the centrifugal areas. That means the face and the limbs. And usually the patient sometimes can also have, the patient can also have sometimes a few unusual presentations. When we talk about unusual presentations, that'll be like their genital organs, they might have, suddenly this kind of a rash which is there and nowhere else in the body. Next slide, please. Now, it's prevalent in several African countries that I told you already. And of course, wherever else it's happening in the world, it's primarily getting imported from these countries. We know that, now in US, in UK, Israel, Singapore, etc. In all of these places, monkeypox has now started becoming prevalent, primarily because it's been transmitted from the animals into the human beings, and then from human beings it's been transmitted across the continents, primarily because of the travel habits which people are now having. Next slide, please. Transmission, as I told you, generally it's because of the close contact, and what actually gets transmitted is the virus, which I showed you in the first slide. The virus can actually remain on the fomites. That means like on table, on laptops, on mouse, etc. Any of these, even the knobs of the doors, etc. You can have the virus still there, and it remains pretty stable for some time. And this virus eventually can get transmitted from one person to another, either through the droplet infections, like when we have like what we used to have in COVID, or they can travel from skin to skin. And therefore, again, something like what we did for COVID is what is expected to be done in this case also, to prevent transmission. The good news, as I mentioned in the slide at the end, is that it's not easily transmitted. Even though it is there, it may not get transmitted unless you are, giving that virus a lot of time for it to get, kind of clinging on to your body, because most of us have good immune systems to fight this kind of a virus. However, people who are relatively less immune have a chance of getting this infection more often than the ones who don't. Next slide, please. Now, when we talk about diagnosis, how do we get to know whether it's really monkeypox or it's something else? The problem in this country, at least on today's day and age, even though we have a proper appropriate guideline from the Ministry of Health and Family Welfare regarding how to look at it and how to diagnose it, but the important point is that we do not have labs in general doing this particular testing. So for all practical purposes, a high index of suspicion, especially for the people who've traveled abroad in such areas and have been exposed to these kind of viruses, are the ones who need to be tested. Next slide, please. So the test, as you have seen with the COVID also, is the PCR. This is a PCR based testing which is done in this case. I have shown you there are three pictures which you're seeing in front of you in addition to the PCR machine which you're seeing on the left. But what you see here is that you can use the monkeypox PCR, and in monkeypox PCR you are able to pick up the detection of this particular virus. And once you have found it positive, again the treatment is kind of symptomatic. Next slide, please. Now, what samples and how do you collect the samples? The people who are absolutely asymptomatic, generally speaking, for you to pick any sample is pretty difficult. But people who are having symptoms, for them, there are two kinds of samples which you can pick up. Either you can pick up a sample from the rash, because the rash will also be, kind of giving you some kind of fluid. So that fluid needs to be taken and sent across for PCR technique. And then in the recovery phase, if you do not have any rashes available in a patient's body, then you will take blood or urine, because this virus has the tendency to go into the blood and the urine also. And then once you do a PCR, if the PCR turns out to be positive, then you know that you're dealing with the pox virus. And if it turns out to be negative, then it's need to be investigated for some other causes, because PCR is a very, very specific test for this particular disease. Next slide. Next slide. Now, when we come to the treatment of monkeypox, of course, antiviral therapies can potentially be given, just as the way antiviral therapies are given for say chickenpox or for varicella and zoster. But for all practical purposes, such kind of aggressive therapy is reserved in only a few cases, because majority of the people will have a mild and a self-limiting disease, and in absence of any specific, because we don't have any specific therapy for it, we generally do not try and give very aggressive therapy. And in individuals, majority of the individuals are only given supportive kind of status. Like for instance, if somebody is having fever, you will give tablet for fever and stuff like that. Next slide, please. And again, when we are talking about therapy per se, you have to be worried about those people who have immunocompromised state. Like for instance, patients who are having, again, like similarly what we had in COVID, we were talking about high risk patients. High risk patients will be those who are having, for example, very small children or very old people. Similarly, pregnant or breastfeeding women, or people who are having some other bacterial infections or have some skin ailments. In all of these people, you have a potentially higher chance of contracting this infection, one, and more importantly, giving you severe complications. So in such cases, you need to give them adequate therapy, and maybe even hospitalization will be required. Next slide, please. Now, how do you kind of treat these patients? As I told you, no specific treatment per se, but what we expect to do is that at least we isolate them from the rest of the people so that we break the transmission part of it. And antiviral therapy, there are certain drugs which are used in this particular disease with the consultation of doctors. Such antiviral therapy may be beneficial in some cases, but it is not extensively useful in every case, because there is again no specific therapy. So 3 weeks is what we are expecting people to be isolated from the rest of the world, so that they do not give infection to the rest of the people. Next slide. And of course, these are some studies which have been done using antiviral therapies. And if you combine all of them and see the graph which I have given on the right hand side, the green line actually gives you the idea that this green part of it suggests that therapy with antivirals is definitely sometimes very helpful. Next slide, please. Now, as we know, everybody would immediately talk about vaccines. Do we have vaccines for monkeypox? Well, there are two vaccines which are, actually produced in the world. We don't have them in India, at least as on date. But hopefully, there is a process in which people are, kind of keeping this on a close watch and a close eye. And as you know, we happen to be one of the biggest vaccine manufacturers in the world, and therefore we are already manufacturing some of them, not for India, but for other countries already. So I don't genuinely feel that in case there is a need for us to develop this vaccine and produce this vaccine for our own people, we should be able to do it. Now, these vaccines, two of them, as I have mentioned in this slide, this is the Genuos, which is a modified attenuated vaccine, wherein the pox virus has kind of been stunned, and the same virus is then used for giving us immunity. Next slide, please. Next slide. Yeah. And in this one, we have the Ecam 2000, which is again a manufactured vaccine. However, what is most important is that this was kind of withdrawn some time back. This was a vaccine which was primarily used for the smallpox disease previously, but it has also been found to be useful and an investigational platform in monkeypox. So these two vaccines are potentially available. Of course, fortunately, so far we don't have a challenge of getting the disease per se, but we need to be extremely watchful. Next slide, please. Now, this is the comparison between the two. You have the modified vaccines with modified viruses in both of them. And there are generally very few serious adverse events in the Genios one, which is an attenuated vaccine, which is already being used. And usually is given by the subcutaneous doses at 28 doses apart. So usually 2 doses are given in Genios, whereas in ACAM, it is only a single dose vaccine which is being administered. Of course, it's still, as far as the Ecam 2000 is concerned, it's still getting kind of validated. Next slide, please. Now, this is the complications, severe complications of uncontrolled viral infection that you see in these patients. And therefore, so patients who will be having uncontrolled viral replication, they can have this kind of a progressive disease, which can happen, and it can be extremely disfiguring also. You know, the patients may not be really happy having this kind of a disease. So one therefore needs to be very clear that we would like to prevent rather than have the disease and then start treating. Next slide, please. So with that, I come to the summary and the take-home message. We know that the cases are on rise globally. Of course, more prevalent in the African nation, and a lot of them have also moved on into the America, especially the Northern America, and to a partly to the UK. What has started happening is the Center for Disease Control US as well as the Center for Disease Control in India have started collaborating on establishing network centers wherein we will be able to take care of the patient should such a case arise in any of the centers here in India. The biggest thing that what we have observed in this particular disease is this is again a thing where we are trying to transgress into the animal kingdom. You know, we would not have gotten this disease because the disease was not meant for human beings. It was only an animal disease, but because we broke their system and we got that animal into our picture by eating their meat or dealing with their fur and some other ways, we got the disease into our system. Now we know one thing for sure: monkeypox outbreaks have been and are still continuing in Africa. And what is extremely important is that people who are traveling to these places should ensure that they don't come in contact with such people who've been, you know, kind of dealing with these kind of animals on a regular basis. And if one does, then one needs to make sure that he or she is taken care of appropriately. So I think with that, I would end my talk, and I think I would like to lay it open for discussion and questions with everyone. Thank you very much for your kind attention.
Thank you so much, Dr. Anil, for the informative session. It has actually given us a lot of information and value to us. So I would request each and everyone, if you have any queries or questions for Dr. Anil, please type it in the chat box so that we can take it up with the sir. Dear all participants, if you have any queries, so please type in the chat box. Sir, Rahul is asking, what are the chances of spread during rains in cold and flu?
So as far as, see, the thing is, chances of spread of monkeypox is very clear. It has to come from somebody. Fortunately, in our country so far, we do not have, you know, any specified defined cases so far, not yet. But the point is that there is a probability, because we all keep traveling abroad, and you know there is a probability we come across with people who can potentially transmit this infection to our country, and that's where we need to be careful about. As far as rains are concerned or monsoons are concerned and waterlogging, etc. is concerned, that itself does not cause this complication because it is not really a transmissible disease in terms of waterborne and stuff like that. It is a disease which is primarily coming from a person to a person or from these animals. It's not only the moment we call it monkeypox, just please remember it's not only coming from monkeys, it's also coming from the other animals like squirrels, like rats, etc. Because this pox virus can be transmitted from monkeys to these small animals as well. So what we need to be careful about is getting in touch with these animals, number one, or those people who have gotten this infection from somewhere. So that's what is very important. But it doesn't get transmitted because of the rains. As far as
Thank you.
another question, I can see there is a question which says, what is the precaution about it? I did mention about it. See, the simplest way to uh, be careful about it is that, don't get exposed to people who are already having it, or don't go to the areas where there is a probability of getting it. So the African nations, preferably avoided, at least at the moment. And if not, if you're still going for work there, avoid the people, who are already having this disease. Otherwise there is a possible potential of getting into unnecessary trouble.
Thank you, sir. So Dr. Husna Manu is asking, should we take a precautionary vaccine for monkeypox?
So if I have understood the question correctly, it was regarding what should we do? What was the question? Sorry.
So Dr. Husna Banu is asking, should we take a precautionary vaccine for the monkeypox?
Okay. So the thing is, while that would be a nice thing to do, but the biggest problem that we have is that we don't have a vaccine in India yet. So since we do not have a vaccine available in India, you will not be able to take this vaccine at this moment of time. As far as vaccine availability in India is concerned, government is treading with very close precautions in itself by ensuring that, in case we need to develop, we need to produce vaccines for our own countrymen, it will be possible because fortunately we have a very big facility of producing vaccines. You know about Bharat Biotech and you know about Serum Institute of India. They are capable of producing this vaccine, and therefore we should not be really worrying at the moment.
Mr. Anand is asking, how much time will it take to reach this monkeypox in India? Any anticipation that we are doing right now?
So again, when we go to Ministry of Health and Family Welfare documents which are available on this in this area and in the subject, and the task force meetings, fortunately, of which I've been a part, what we realize is we don't envisage it coming to India. We honestly don't envisage it coming to India in a way where it is affecting Africa and US at the moment. The reason why we don't expect that to happen is that our exposure to the African nations directly with respect to this kind of a thing has been minimal. However, having said that, as we keep opening up the borders the way they are getting opened up, and as we have started traveling internationally pretty significantly, and people are also traveling vice versa, that's from African nations, etc. The chances of this virus traveling across to India is there, and we are currently keeping it at a chance of somewhere around, maybe 5% or so. Having said that, we still are pretty optimistic that the disease doesn't spread that easily. It's not like the way COVID spreads. So therefore, we are hopeful that it may not be that bad in our country.
So Mr. Pradeep and Mr. Faisal, they are asking which group will be more affected and how to identify a monkeypox.
So as far as monkeypox is concerned, unfortunately, it gives you a disease which is similar to what you get in cough and cold. That's the biggest challenge which all of us have. So initial period for at least one whole week, people will just have body ache, malaise, fever, etc., and you may not actually get the rash. It's only the rash which tells you suddenly that are you dealing with monkeypox, and that's where people start questioning it. So therefore, for all practical purposes, we don't imagine we have a monkeypox because practically in our country, chances of we getting a regular cough, cold, and at the current circumstances, COVID is much higher than what we have in terms of monkeypox. Having said that, the moment we start getting a rash of the pictures which I showed you in my presentation, if you have such a kind of a rash, if for any of the patients has such a kind of a rash, it's very important to get in touch with the health authorities immediately. And in Delhi, at least, we have these government ones which we have to go to. And from there, the sampling will be done and they will be taken across to National Institute of Virology, Pune, from where the testing will be done and immediately it will be identified and defined. If that is the case, then therefore they will treat it accordingly.
Thank you, sir. So Apurva and Payal are asking how long is the incubation period and what is the mortality rate in this disease?
So as far as the incubation period is concerned, I did mention it in my presentation also, but to reiterate, it's between 1 to 3 weeks. That's about 6 days to 21 days is the incubation period. And that's why when somebody contracts this infection and we have proven it, we would ask the patients to, remain isolated for that period of time. And again, when we talk about this incubation, we do not expect the disease to be very bad to people. So therefore, it will be a very mild disease usually, and the rash also is very minimal. However, if the patients are having immunocompromised status, now immunocompromised status can be due to anything. It can be due to diabetes, it can be due to age, it can be due to, say, an underlying disease like cancer, it can be due to, say, HIV. In all of these people, this virus has a probability of developing far more than in a healthy individual, and that is why in such patients the disease becomes more severe, and invariably it can affect the eyes and it can affect the heart and it can also affect the kidneys. So when it starts affecting these organs, if somebody has a vulnerability, then there is a probability of fatality. As far as case fatality rate is concerned, less than 1% is what has been observed so far in the humans who have contracted this infection. So therefore, again, it is not as severe as we were seeing for COVID. COVID was a very different ball game altogether. But as far as this disease is concerned, the severity is not to that extent.
Thank you, sir. Abhishek Sharma is asking, are there any fatalities in pregnant females and why the virus spreadability is so low, unlike we see in COVID-19?
So, actually, I am very happy that the virus is spreading slowly. The reason is because when we talk about this virus getting spread, what has started happening nowadays, especially, is we all have started, the moment we start getting cough and cold, we preferably start wearing a mask. So that has helped us to, reduce the amount of virus which we are shedding from the nose and the mouth. Now, when I'm saying this, again, the primary mode of viral transmission is not through the nose or through the respiratory droplets. It's primarily through the skin rash. The rash which happens on the skin, on that skin, whatever virus comes, that gets shed. And fortunately, the moment people get that rash, they isolate themselves or people don't even try to get in touch with them. So that is perhaps the reason why we are not getting so many cases of, monkeypox across the globe as we were getting in COVID-19. Because again, in COVID-19, a lot of people were absolutely asymptomatic. So which does not seem to be the case primarily in monkeypox, at least as on date. We are still learning. There are a lot of things which we still don't know about monkeypox virus, but whatever little we have been able to gather so far, this is where we stand.
Thank you, sir. So, and Manoj is asking, is there any Ayurvedic medicine for the monkeypox? And if there is, then can we have the name for that?
So I am not aware of any Ayurvedic medicine. The only two vaccines that I'm aware of, I've already mentioned to you. Out of that also, only one of the vaccines is predominantly being used globally. The other one is the trial format. Ayurvedic medicines have not, to my knowledge, have not been there. And there is a pretty simple reason for that, because this virus was never available in India. And obviously, Ayurveda primarily has its seat in our country. But I'll not be surprised if Ayurvedic medicine does come up in due course of time.
Mr. Shrihan is asking, does the monkeypox virus have any variants?
So having a variant of a virus is the norm. It's like evolution of any organism on the surface of this earth has to be through production of variants. For example, if we talk about human beings also, we started from monkeys and that's where we are today. Similarly, when we look at viruses also try to make sure, because it's ultimately they want to survive. So therefore, viruses will keep on mutating and there will be variants. So far, we know only a single variant of monkeypox which has been picked up. However, viruses are bound to change, they are bound to mutate, and there will be variants of monkeypox. Fortunately, what happens, and as we have seen in COVID also, as the viruses will mutate, their lethality becomes lesser and their effect becomes lesser, and they become more amenable to having like a symbiotic relationship with the host, like humans. So I am hoping for that, and let's hope that we don't have a severe kind of a virus strain coming in, which can be detrimental to all of us.
We have another question from Mr. Faisal. What is the recovery rate in the affected region?
So that's the best thing about this particular virus. The only challenge which we have seen so far is the morbidity because of the skin lesions that we have. Because once the skin lesions happen in florid manner, they generally leave a trail behind. You know, you would have seen in some of the people who had small chicken pox in their early lives, they would have that, you know, kind of depressions in their on their face and stuff like that. So similar things on the skin part of it do remain, but that happens in less than 1% of the cases. Majority of the patients, as I told you, have a very mild disease and they get well, and they generally do not have a major challenge unless they have some immunocompromised status along with.
Thank you so much, sir. I think these are the all questions that we were having in our chat box. And it was really nice, and it was really good to have you on the platform to share this valuable information with us. I think every one of us are more aware about the monkeypox. And thank you so much, sir, for coming to this platform and sharing this information. Much
Thank
from
you
all
very
of us.
much, everyone.